Why are the EPO and PPO plans so much more expensive than HMO plans in California? Hello, I am Kevin Canals with InsureMeKevin.com, a certified health insurance agent with Covered California. And oftentimes, whether we're going through Covered California or off exchange, my clients and myself are sometimes really surprised at how much more the EPO plans and PPO plans, the monthly rate is over the least expensive HMO plan. So for instance, in Santa Clara County, an individual age 40, the least expensive HMO plan is $483 per month, and the PPO plan, the most expensive one, is $821, 70% more. Looking at Los Angeles, for the same 40-year-old individual, the least expensive Silver 70 is $345, and the most expensive PPO is $594, a 72% increase. And then you can see that one of the EPO plans is 32% higher, and another PPO was almost 60% higher. And this is all a little frustrating sometimes because one of the focuses of the Affordable Care Act in some of the regulation was to kind of constrain those costs. And one of the things they did was to implement what is called a medical loss ratio, which says for individual and family plans, 80% of the healthcare premium dollars must be spent on healthcare services for the plan members and quality improvement. And so it doesn't make a difference if it's an HMO, EPO, or PPO, 80% of those dollars need to be spent on healthcare. And also, there needed to be standard designs. Those bronze, silver, gold, and platinum plans all needed to be similar so that there couldn't be any games being played. In California, it's even tighter in that we have a standard benefit design plan for the bronze, silver, and gold, and platinum plans, and it does not make a difference whether it is an HMO, EPO, or PPO. When you are in a Silver 70, your cost sharing is the same. So primary care visits, $45, specialist visits, $85, emergency room, $400. And again, it doesn't make a difference what type of plan model it is, that is the cost. And similar with prescription medications. The generics have to be a certain amount. Tier 2, Tier 3, Tier 4 drugs all have to have the same co-payment after any pharmacy deductible. And of course, drugs are a big driver of healthcare rates because they're very expensive. Now, some of the carriers have some different formularies and different tiers that they put their drugs on, but from some of the studies that I have seen, at a minimum, 15% of a healthcare dollar goes towards prescription medication within the premiums. 22% of the healthcare dollar goes to physician services, and 38% for hospital services, because hospitals are expensive. So even though we have these kind of cost constraints with a medical loss ratio and the standard benefit design, it really is the healthcare plan model that can contain costs and consumer behavior. So the Health Maintenance Organization, HMO, requires a primary care physician, PCP, and that doctor is the gatekeeper to other services and prescriptions and tests, and to see any specialist. So you must see your PCP before you go to a specialist for any treatment or diagnosis. And with an HMO, there is no out-of-network coverage. Now, with the EPO, you do not specifically need to see a primary care physician. One may be assigned to you. You can go straight and see a specialist if you have a problem with your ear or your skin. You don't need to see your PCP first. But there is no out-of-network coverage in an EPO, very similar to the HMO. With the PPO plans, Preferred Provider Organization, no PCP requirement, You can self-refer to a specialist, and there can be some out-of-network coverage. It's kind of, even though the plans are all the same, my analogy is we have these two cupcakes. They look exactly the same, but sometimes when people view those two cupcakes, which are exactly the same cost to purchase, they see them differently. And one cupcake looks better to them than the other one. And if it's the same price, they're going to go for the better looking cupcake. And that's kind of what we see. That's the consumer behavior we see when it comes to EPO and PPO plans in the consumer decisions. Because the EPO and PPO plans generally have a larger network of providers that the plan members can go see. So some of the popular hospitals and medical groups that you can get with an EPO and a PPO plan versus an HMO would be Cedars-Sinai, Hoag, Providence, Sutter, UC Davis, UCLA, UC San Diego, UC San Francisco. And those are very popular, prestigious, renowned medical groups and hospitals that people want to see. And they also command higher reimbursement rates for their services versus some of the other hospitals. So when those providers, those sprinkles on the cupcake, are included, it's going to cost the health plan more to make that cupcake, but they can only charge so much for the particular service. So what is happening is that we're seeing a higher rate to offset that because they can't charge more for an office visit in a PPO or an EPO plan with the Silver 70. Another benefit that the PPO plans have that is kind of underestimated in the overall cost to the health plan is the out-of-network coverage. Now, generally, to use the out-of-network benefit before the plan will share in any of the costs, the health plan member must meet an out-of-network deductible, sometimes very high, of almost $10,000. Once the deductible has been met, the healthcare plan will share 50% of the allowable amount of the healthcare services until the individual meets their maximum out-of-pocket for out-of-network coverage, which can be high, $25,000. Then the health plan will cover generally 100% of the allowable amount. That may not be the whole amount because when you're going to an out-of-network provider, they may charge more than the allowable amount. But there is no cap on coverage for that out-of-network allowable amount. And people will go out of network to save someone's life. They will go to a prestigious, prominent, world-renowned cancer center or surgeon. And yes, those services may cost $250,000, $300,000, $500,000. And while the plan member may pay $30,000 or $40,000 when it's all said and done, they may only be paying 10% of the overall cost. And the health plan has had to shoulder the balance. So that gets factored into the overall costs of the health plan because remember, they must spend 80% of their premium dollars on healthcare costs. So that inflates the overall healthcare spending of the PPO plan, and that must be reflected in the rates. And it only takes, half a dozen people using out-of-network services with very, very large claims to really push things up. And that isn't to say that you can't get great health care with an HMO plan. It's just that some people view the cupcake differently and they want some of those other benefits, those other sprinkles, like being able to go out of network or to bypass a primary care physician and go straight to a specialist, which will cost the health plan more money because it is a specialist and they command higher costs for their services. So that all gets put into the mix, and that's not the entire story, but that is one of the reasons why EPO and PPO plans are so much more expensive plans in California. So if you have any questions or comments, you may leave those down below and I will do my best to answer them. So for Kevin Canals, InsureMeKevin.com, have a great day.